bleeding from the gums when you brush. So when people see bleeding, they ignore it. They go, maybe it's because they use a hard brush, or maybe they were too aggressive, or maybe but they don't see it as a problem. But that's the very first symptom. That's the very first sign of gingivitis. And ignoring it means that it will continue to progress. As more plaque builds up, the gum gets more inflamed, more irritated, and then of course it will bleed on slight probing. And so the area signs: bleeding on brushing, sensitivity, or some discoloration on your teeth. Something is going on that you should check and you should investigate. And so because it doesn't come with something serious until it becomes unbearable, it doesn't come with something serious initially. So okay, well, let's see, it will go. Let's just do this, let's just do that. So those are the signs that people overlook, some of the signs that people overlook.
Thank you very much, doctor. So why then do people then fear the dentist so much?
Well, one comment I usually get from patients that are anxious of dental treatment, one thing is they're afraid of the needles, they're afraid of the instruments that we use. So you will hear some patients say that they use plier or they use screwdriver or something to to remove their teeth or to extract or to do something, but no, it's really not so. And they also have this myth or this thing where they feel like if you come to extract one tooth, the problem jumps to another tooth, and then eventually you have to extract all of your teeth and you have nothing left. And it's something I always correct because that's not true. That's not true.
Mm.
And those are some of the things that people consider. Those are things that plant fear in their hearts. And sometimes some patients have some negative dental experience. So before coming, based on what they experienced some years ago, maybe with some other dentists, or maybe they didn't even go to a professional, they have gone somewhere and they were not attended to properly, or the wrong techniques were used and the patient was not managed well. So they will carry that same impression, that same negative impression when they are coming to the clinic, or that would even hinder them, that would even stop them. They will say they are not even coming to it at all, or they've had some negative experiences from other people before coming. Many patients, when they come, they already have this notion that we're going to cause pain, it's going to be painful. And so I asked them, who told you so? They say somebody, a friend told them it's going to be painful. It's going to be, no, it's not true, it's not true. So then I try to reassure them, counsel, and all those things before we start the treatment.
Thank you very much,
Okay.
doctor. My last question is: so can small untreated issues eventually become serious health complications and expensive?
Yes, yes. Um, what's complication there? And some people may be
Mm.
surprised that patients can die
From tooth. Wow.
from, from caries. You'll be surprised. Dental caries is an infection, it's a dental infection, and if it's not attended to, it will progress. So something as small as a cavity, of course, it started painless. You didn't feel anything, but it continued to progress. And now the whole tooth is infected. Nothing was done about it. Now the bone is infected. Now the surrounding tissues are infected. And so it continues to spread like that. It continues to spread until it becomes something serious. We've had patients that presented with necrotizing fasciitis, that's flesh-eating bacteria, and it all started from a toothache. And sometimes the patients are somewhat religious about it. They say that they stepped on somebody stepped on their saliva, and so they started feeding them. And so instead of coming to the dentist, they went to church or they went to some place to do some remedies. So the small problems, they always, if not attended to, they
Yeah.
always to more complicated cases. So yes, the worst complication, like I said, is death. You'll be surprised, but it happens. It happens.
Right. Thank you so much, Dr. Akisanya, for Aki Folarin. Akisanya, yeah, I'm correct now. Yes.
Yes.
Yes. Many people believe that if the pain stops, the problem is good. So what, let me give an example. My tooth is hurting and then I do the salt water solution and then it stops. Is the problem gone or that's just a temporary solution?
Yes, it's still important that you visit the dentist. Yes, you had toothache, you did something, and it seems to work. It doesn't mean that the problem has resolved. Something may still be going on, and you may recall, particularly with third molars, the last molars, your wisdom tooth. Sometimes the symptoms go and come.
Mhm.
You have recurrent peritonitis, so you do one more time salt first. Of course, it will go. You think you're free, but give it a while, it will come back. So it's important that you see a professional so that it's properly attended to. When you come, investigations will be done. You do dental x-rays, you do what is required. Okay, we can now see that okay, clearly this is what is going on. This is what we have to do to solve it. And
Mm.
when we have done that, we can be sure that there are no more problems.
Okay.
So what
And
and thought rinse doesn't always work for all the problems. Yes.
right.
Very
Okay.
relieved.
Okay. Can oral health affect other parts of the body beyond the mouth?
Definitely, definitely.
Ah, how? How so?
Like I said, the oral health is also part of your general body health.
Mm-hmm.
Let's start with what you mentioned earlier, toothache.
Mm-hmm.
Then your head starts to ache, your ears are
Mm-hmm.
paining you, your eyes are paining you, pain is radiating to your neck, your cheeks are swollen, your necks are swollen. It's still part of your body, and so they are related. When an infection is going on in your mouth, it's still part of your body. Sometimes you'll be feverish, hot. You think it's not just from my tooth, it's not from the only from it's not just from your tooth. Your tooth is part of your body. You're feeling something in your if you have some problem with your hands,
True.
your chest, your
True.
leg, still part of your body. So let me give you an example. Um, yes, there was a patient that presented that had a swelling just beneath the jaw. So of course it was from a toothache that was not treated, was not attended to. So pus started to build up somewhere. Started
Uh-oh.
And so the patient was hot, the patient was feverish, the patient had not even eaten in like 2 days, the patient had not slept properly.
Mm-hmm.
And all of these things, of course, will affect the rest of the body. And the patient is weak, the patient is fatigued.
Mm-hmm.
Things now have to be done to manage the patient, to take care of the patient. So, yes, definitely, oral health is always related to general body health. And if the problems are not attended to, eventually they would affect the rest of the body.
Right. Hmm. Okay. Thank you so much for that. How often should we visit the dentist, even if we know that there's nothing wrong with our teeth? Interesting. I always have like anecdotes to share. I think I met someone who told me they always do dental examination. Is it once a year, be twice a year? And I was so shocked because I was of the opinion that you only go to the dentist uh when something is wrong. But yeah, from a doctor now, from a dentist, how often should we visit the dentist, even if we believe that our teeth is fine?
Okay, thank you. Well, you're supposed to visit the dentist every 6 months.
Ah,
Every
okay,
six
I'm due
months.
for one.
Whether you have anything or not, whether you have any dental problems or not, you have to visit the dentist every 6 months. It's just for routine checkup. If there's
Right.
anything going on, you detect it, and then preventive measures can be instituted. And so the problems that you would wait until they start, we can even arrest them before they start at all.
Mm-hmm. Mm-hmm.
So important that you visit dentist regularly every 6 months. Yes, every 6 months.
Right. Okay. Okay, so sorry about that. What are the most common dental mistakes that people make without realizing it?
Well, let's start with the simplest. Let's start with the simplest thing, and that is toothbrushing. So many people brush with the wrong techniques. They brush with the textures, brushes that are too hard. Yes, hard textured brushes when they don't need those kind of brushes. Um, some of the patients brush with non-fluoride containing pastes. And so, just starting with that, the simplest thing is toothbrushing. So, the pattern that patients brush with, or some people brush with, some people use horizontal brushing pattern, and they brush very aggressively, and they brush with hard texture toothbrushes. Some even use very abrasive content like ground glass, sand in the bid to whiten their teeth. In the bid to whiten their teeth, they use all of these things, and in the long run, they have deleterious effects on your teeth and your enamel. They tend to wear down the enamel. They tend to wear down the teeth. So you're using ground glass because you want to whiten your teeth. Those things will just end up wearing down. In fact, eventually, you wear down the outer layer of that tooth. That's called the enamel, and you
Mm-hmm.
expose what's inside. That's dentin, and later you start to feel sensitivity. Sometimes some people use the horizontal brushing pattern I mentioned. There's a pattern of wear that happens close to the gum line because of that particular pattern of brushing. Eventually, also, it will lead to dentin exposure and
Mm-hmm.
hypersensitivity. So, some of the mistakes that people make are using all this, though they try to, I don't want to call it supplement, but they try to modify, improvise. Yes, that's the word, improvise to in the bid to get something better. But it's important to follow the proper techniques and to use the ideal materials. Yes. And also about that brushing, we have to brush twice a day, not once a day. And what's commonly known is that you brush after you eat. But what
Huh.
you should what's commonly known, yes, what's commonly known is that you brush before you eat.
Before I was yeah,
Yeah. Before
but
you eat. You're actually supposed to brush after you eat.
that's because you've already brushed the night before, right?
Oh yeah. So if you have brushed the night before, the mouth is clean till the next morning and you
Huh.
can then eat, then brush. Then your mouth is clean till you eat again. So
Right. So, just not to take you so far off again, I'm coming back to this point. How often should you change your toothbrushes?
yeah, you should check your toothbrush about every 3 months. Or
Okay.
once you know
Ah,
that the bristle starts to flare, you should change your toothbrush.
once the bristles are
Yeah, flaring. Once they
flaring.
are
Oh,
looking right,
flaring.
you should you should start to change
I'm
it.
picturing my toothbrush, right? That's why I'm laughing. Oh wow, oh wow. This is still Women Reading at 1.7 FM. You can make way to start calling in or sending in your questions and whatnot. 07000 or 0800 Call us to tell us what's up. Like, did you have questions for the doctor? Okay, back to the eating one. So you brush the night before, and then your teeth
Yes,
is clean enough for the morning. You have your breakfast, brush after.
yes.
Right. That's interesting. Okay. What about self-medication for dental pain? Because typically what people just do is when you're feeling like your teeth is throbbing or is hurting, like I said, I would do salt water solution, or you popping a painkiller to help with the pain. How risky is this?
Well, you have to. It's important that you follow prescription. Yes, because most of the patients, if not all of them, before they come, even with the dental pain, they've already gone to some chemist to get some over-the-counter pain relief medications,
Mhm.
and they get all kinds of medications, they get all kinds of advice and recommendations from those people. And some of these things are not they are not professional advice, and so it ends up worsening the matter. And there's some pain relief medications that certain patients cannot use. For example, patients that have ulcer, they cannot use certain pain relief medications. And if the chemist or whoever sold the medication did not ask certain questions, you just give them something for they to take and use. So it's important to get a prescription from a doctor, and then you can use those medications. So self-medication is not advised. It's not advised.
Okay. I was going to ask a question. I remember the question I wanted to ask about brushes. There are these tongue scrapers that I see people use. Is that recommended or is it risky?
Yeah, well, the risk is there if it's done aggressively.
Mm.
If it's not done carefully, yeah, you can damage the taste buds, you can
Hey,
damage the feeling on the tongue. So it has to be done carefully. It has to be done carefully.
what happens
And
if you damage your taste buds? You won't be able to taste anything.
yeah, yes, you have reduced taste sensation.
Ah, that one we don't
Um,
want.
so you'll be able to taste well, you'll be able to taste properly. And we all know that
Mm-mm,
that's not
mm-mm. Okay, one final question for hand over to Dami. Do you see or have you ever seen cases where patients come in when it is too late to save the tooth? That what happens after that point?
Yes, yes. The last option is all the last option is extraction. Extraction is always last consideration. Like we all try to save the tooth first. So, but sometimes the patients come when it's too late. The cavities built up over time. Some people have never visited dentists before, and so these things have built up so much that it starts to grow underneath the gum. And of course, these plaque and calculus, they are made mostly of bacteria. And these bacteria will eventually destroy the surrounding bone and the supporting structures of that tooth. Eventually, the tooth will become mobile, shaky, and it can fall off.
Hmm.
So there's some grade of mobility that you just have to extract the tooth and you can't save it. So there are cases like that, yes, where you have to. There's nothing more can be done to save the tooth, and
Hmm.
that's
Hmm. Okay.
Thank you,
Dami,
doctor. Thank you, doctor. So, doctor, for someone who is experiencing symptoms but unsure whether it's serious enough to visit a clinic, how can telemedicine help them?
well. No, there's no pressure really to jump at any dental clinic you see around. Consultations first. Talk to a doctor, talk to a dentist, and let them figure out what the problem is. And then from there, you can know where to go or how to approach it. So yeah. So telemedicine is very important for people that cannot visit the clinic immediately or are afraid of waiting times or are bothered about all other things that they experience at the hospitals. So telemedicine allows them to connect instantly to whatever doctors that they want to talk to, that they want to see, and get their problems attended to as quickly as possible. Yeah, it's going to help go a long way to assist patients to see their doctors immediately, talk to their doctors, talk to somebody about something going on. It doesn't have to be when it is big, when there's nothing more you can do about it. But there's something going on now, and I need to ask the doctor about something. Of course, I know, okay, I can always talk to the doctor, tell me, tell the doc.
mm,
That's right. Teledoc also gives people access to verified dentists who can guide them on early problems before they become emergency. You're listening to Radio Doctor on Women Radio 91.7, powered by Teledoc. Teledoc allows you to obviously book at your preferred time, join a secure video call, upload medical records, and receive prescription digitally. It is healthcare made simple and secure.
yeah, the phone lines are now open 07000 or you can call our toll free line or 800 so that we can hear your questions, your thoughts, whatever it is that you want to ask the doctor today. Dr. Kisaya, who's here with us, speaking to us on why people ignore dental problems until it's too late. So if you have questions about maybe tooth pain, gum problems, maybe bad breath from a friend or from a spouse, call. The doctor will answer. Dental care, hygiene, whatever else, please call. Okay. Over to you, Demi.
All right, doctor, let's talk about some warning signs. What symptoms should people never ignore?
When pain starts, you should never ignore it. When pain starts,
Like
of
that.
course, of course, people when the pain starts, some people feel like they can chest it. They go and take
Yeah,
some
I have high
pain relief
threshold for
medication.
pain.
Pain relief. And so they're going to take pain relief medications and just manage it. But no, once pain starts, that's an indication that something serious is already already happening, and you should visit dentist. So that's one thing you should never ignore. That pain, you should just not ignore it. Some people, of course, will overlook the bleeding and bleeding when they brush, the um, occasional sensitivity somewhere here and there. But when the pain starts, don't ignore it. But once the tooth starts to shake, there's something serious going on already. So yeah, some of the warning signs you should not overlook: pain and mobility. When that tooth starts to shake, eh, because eventually that tooth will fall off if you don't do anything about it. One day you're just brushing and tooth just removes. You'll be surprised. So yeah, thank you.
Mm. Okay, so you mentioned bleeding when brushing. Is that a normal thing, or is there an underlying problem going on there?
Bleeding on brushing is not normal. It's not
Hey,
normal at all.
I'm picking about my life. No, that's the tip is
It's
clean
not
now.
normal. It means that your gums are inflamed if you are bleeding and brushing. That means that there's something irritating with gums and you
Okay.
should get them checked.
Okay.
So plaque may have been building up where your brush cannot get to, or your brush cannot reach, or there's a spot you're not brushing properly. So eventually the plaque hardens and becomes calculus, and that one brush cannot even get it out. What's going to get out is cleaning and polishing. So bleeding and brushing is not normal. Once you start to see it, that's one of the early signs of gingivitis, of gum
Hmm.
disease. And so once you start to see bleeding and brushing, there's something going on because eventually it will progress to periodontitis and eventual loss of that tooth. So yeah, you should once you start to see bleeding or brushing, you should get it checked.
Okay.
All right, thank you, doctor. So, if in a situation where someone has bad breath, and that indicates that there's a deeper health issue, or it's just normal bad breath.
Yeah,
How
bad
do you
breath.
get normal though?
No, no, no. Bad breath is not normal, though there are several reasons or several causes why the breath will smell bad. One thing is dental caries, cavity, a hole somewhere can cause bad breath. Accumulation of this plaque and calculus that I mentioned earlier can cause bad breath. Some dental infections can cause bad breath. If the tongue is not clean properly, if the tongue is not clean properly, it can cause bad breath. If the mouth is not, if the teeth are not brushed properly, it can cause bad breath. Those are local causes, things that are limited to the oral cavity, the mouth. So sometimes there are some other systemic conditions involving the rest of the body that may cause some bad breath. For example, particularly from gastrointestinal region. For example, from the stomach, some ulcer patients may have some bad breath, especially if it is
Hmm.
uh, quite serious, quite bad. Let me put it that way. Some gastrointestinal diseases like ulcerative colitis can also cause bad breath. Um, Patients that have reflux disease, GERD, gastroesophageal reflux disease, thank you, can also have this bad breath. So some systemic conditions also can contribute to that bad breath. That bad breath is what we call halitosis. And sometimes there's really nothing wrong. Like nothing can be traced to the mouth or the rest of the body. Patient just feels like they have bad breath. They say that people around them shy away or they look away or they close their mouth when they are talking. And so they are worried that maybe they have bad breath. So sometimes the bad breath is not really there. And so we get people to we check ourselves and we confirm again with two more people, okay, man, there's nothing going on. So we try to reassure the patient, calm the patient down in that situation. So bad breath is not normal. Several reasons could be responsible for that bad breath.
Thank you, doctor. I know you mentioned that obviously they have, as a dentist has to check, what's going on for that bad breath. So for an adult, how often should they visit a dentist? And if, let's say, I haven't visited the dentist in like 1 year, can that lead to bad breath?
Well, yes, it can contribute. because one thing you do when you visit the dentist is a routine scaling and polishing, and it's something that you should do every 6 months also. So scaling and polishing removes plaque and calculus and all these things that have built up over time. So that within that 6 months, yes, plaque would have built up and calculus was started to form. If it's not there already, depending on how well the patient maintains a good oral hygiene, how the patient maintains their oral hygiene. So by that time, plaque has started to build up. And like I said, these things contribute to bad breath. Build up of plaque and calculus, definitely bad breath. If you met anybody that doesn't brush properly, that doesn't clean their mouth properly, definitely they have bad breath. So if you've not visited dentist in about a year, you may not have bad breath if you have been maintaining a good oral hygiene. But if you have not been, definitely I should expect that.
Mhm.
Hmm.
Okay. Thank you, doctor. So if someone has like let's say gum disease, what are the early signs apart from maybe blood coming out from the mouth and from excessive brushing? But apart from that, what are some other early signs that people can look out for?
Okay, well, you can look at the color of the gums. Normally, the gums are coral pink, yes, but if the gums are inflamed, they'll be reddish and somewhat swollen. That swelling part, sometimes it may be a bit difficult for people that are not trained to detect it, to really see it, unless it is really swollen, like really inflamed. So, but definitely you will see that the gum line is reddish. That tells you that the gums are inflamed. And another thing you can see is that the gum line will start to recede below its normal level. So gum recession is another thing you can look out for. Though that's not immediate, it's something you will see eventually if the inflammation or the infection or the disease continues. So, but the other things you can look out for aside from the bleeding is the color and the swelling of the gums. Those are the early signs you can look out for.
Thank
Okay,
you.
okay, okay. Thank you so much, doctor. So for daily habits that we have, what's the proper brushing technique compared to just brush? Because people say, "Oh, but I brush every day," but is there a technique to use when brushing?
Yes, there are different brushing techniques, but the technique that is most generally recommended and is easy for people to use is called modified Stillman technique for brushing. So most people brush with horizontal strokes. You just brush back and forth, left to right, and some people say you brush up like vertically from down up or up to down. So, but the proper way to brush is that, or a good technique to brush is that you would orient the bristle of that brush about 45 degrees towards the tooth and the gum. So a part of the brush should be on the gum, a part of the brush should be on the tooth. So then you make quick back and forth strokes, very quick back and forth strokes, after which you would make a flick motion, like a sweeping out motion. So if we're brushing the upper teeth, we are going to uh, position the brush, like I said, about 45 degrees towards the gum and towards the tooth, back and forth, after which we sweep out. So that sweep out for the upper teeth, that means you're sweeping, brushing up to down, that means you're sweeping out, up, down. So after you make the back and forth, up, down, back and forth, up, down, for the lower teeth, back and forth, down, up, or inside out, let me put it that way. So all the surfaces of the teeth have to be cleaned. The outer surface, the inner surface, the top surface of the brush, of the teeth have to be cleaned, after which you brush your tongue. So that tongue part is very important because the surface of the tongue is rough, and so it allows for debris to stick, to attach, for bacteria to attach. So some people that don't brush their tongue, they of course they will have bad breath. You would even see the color brownish, yellowish, sometimes blackish. It will look hairy, and so it's a lot of bacterial overgrowth, and if the tongue is not cleaned properly, that can cause halitosis. That cause bad breath, and yeah. So that's it. The tongue should be cleaned also after you brush. So that's the proper way to brush. All the surfaces must be cleaned. All the surfaces must be cleaned.
And hard toothbrushes. So there are some toothbrushes, medium hard. Which is the recommended texture?
Texture, yes. For adults, medium textured toothbrushes are okay.
Yeah, but some people think
For
that the harder the better.
well, no,
Nonsense.
no. It's not the harder the better. Maybe for smokers and for people with stains, the
Right.
harder the better. Yes,
Okay.
you try to remove those things. So hard brush is not really recommended because over time it tends to wear down the enamel, it tends to wear down your teeth.
Mm-hmm.
And some people that are brushing aggressively, hard brush, that's not a good combo. So medium textured brush is what's okay for an adult. Children, soft textured brushes are fine.
Okay. So medium for adults and then for children, soft textured. Okay. Demi.
All right, doctor. So beyond brushing twice daily, what's good oral care really? What does good oral care really involve?
Okay. Um, good oral care involves coming for your routine checkups
Okay.
every 6 months. Aside from you taking care of your oral hygiene by brushing morning and night, like you do every day, you should also make sure that you get your mouth checked regularly. Come for checkups regularly. Because sometimes some other things may be going on. Yes, that because for example, before you discovered that you're supposed to visit dentist every 6 months, before you discovered you're supposed to brush twice daily, you never seen the dentist before. So you already have, in fact, the gingivitis is already going on. The
Mhm.
plaque and calcium is already there. So now you're brushing twice daily. If you're brushing twice daily, it's not going to remove the calculus.
Mm.
You come into the clinic or you come to the dentist to get skin and polish, it's what's going to remove the calculus. So beyond just brushing, you should also come for your routine checkups. And so that if there are any problems going on, they can be detected early on and they can be treated or attended to. So
Mm. Okay.
One
and
last and
another thing
final question. Okay, go ahead, doctor.
another thing I want to mention is that do not use untested or unprofessional methods. Let me put it that way. Because some well, I mentioned something earlier about some people using ground glass to brush because they want white teeth, or some people adding some very serious abrasives because they want white teeth. I know we have heard that before, but that's not ideal. That's injurious to your teeth. So those things eventually destroy teeth. Some people get some like alligator pepper and alcohol. They already have a cavity, they already have an infection, then they would kill the pulp with that alligator pepper and alcohol. So they won't feel pain again. The pulp is dead, but the infection has not stopped.
Mm.
And so the thing will progress. So untested, unproven methods or unprofessional methods should be avoided. So that should would also help to maintain good oral hygiene, good oral care.
All right, thank you, doctor. My final question is it has to do with sugar, so sugary drinks. Are they causing more damage than people realize, or they don't have any effects on the teeth, and things like that?
Yes, well, they actually cause more damage than people realize. They cause more damage than people realize because aside from the sugar content of these drinks, some of them are acidic. They have some acidic contents that cause erosion of the enamel. Over time, that's another kind of tooth wear. The enamel will erode. It's like melting away. Let me put it that way. And you take some drinks and your teeth feel somehow. I don't know how to describe it. It's the acidic content of that drink, And a mistake that some people would make is that after taking those drinks, they would immediately go and brush. And so the thing is that when that acid has worked on the enamel, it has made it quite soft. And if you brush immediately, you're just going to brush off that layer, you're going to brush that layer away. So you're even going to assist the wear by doing that. So what you should do is that to wait for at least 30 minutes. Rinse and wait at least 30 minutes. Or rinse with uh, baking soda. Yeah, baking soda in water. You can rinse with that to neutralize the acid or the acid contents of whatever drinks you're taking. So the thing is that sugar is the biggest contributor. It's one of the biggest contributors for dental caries. And so because this, we all have bacteria in our mouth, we all have bacteria. So yes, in the long run, they are not so beneficial.
Wow. Thank you, Doctor. Thank you, Dr. Akisonya Samuel Akifalari, dentist, for today's free consultation and advice on insightful discussion on why people ignore dental problems. If you need to speak to the doctor privately, just download the TeleDoc app, search for Dr. Akisonya Samuel Akifalari. You can book a 10 minutes consultation for a full 30-minute session, choose your preferred time, and speak securely via video call.
All right. Again, thank you so much, Dr. Kinsaya, for coming on the program today. Thank you for being a part of our program. Radio Doctor is Nigeria's first specialized radio health program, broadcast Mondays through Fridays at 10 a.m. If you've not learned anything from what Dr. Kinsaya said today, what you should learn is change your toothbrush. The one you've been using, you bought it last year. This is like 1 year, 7 months to 1 year that you'll be using it. Number two, make sure that you see the dentist twice a year. Don't wait till something is wrong with your teeth before you now say you're going to the dentist. Stop. Don't use, what was it that he said you used to brush your teeth? I mean, he gave us quite a long list of what you should not do and what you should do. So take that with you as you go about your day. And the moment you have toothache, go to the hospital. Don't treat yourself, okay? It will come back. And he said that he has seen cases where people have died from tooth complications. So please, yeah, do the needful. Again, many thanks to the producer and Shania. Thank you, Benjamin, also for producing us in the studio this day. My name is Fumi.
My name is Amy.
Have a great day. Have a healthy day. Thank you so much, Dr. Akinsaya, once again.
Thank you so much for having me. Thank you,
Yeah.
sir.
Yes.
Wonderful.
Yes, do have a lovely, lovely day. This is still Women Radio at 1.7 FM. Don't go anywhere. We still have great music, great programs for you on Women Radio 91.7. Catch us tomorrow at the same time, 10 a.m. for another edition of Radio Doctor. Bye for now.
To sponsor this program, call the number 0816 480 7613.
Nigeria, a nation of many languages and many tribes. We will stand together, live together, and grow together. United we stand, united we thrive. This message is brought to you by Women Radio WFM 91.7 FM.
Are you number 87? Okay, please wait.
How many hours have you wasted sitting in hospital queues just to see a doctor for 10 minutes? There's a smarter way. Introducing TeleDoc, your secure digital platform to consult